I'm Dr. Ammar Ahmed.
And I'm Dr. FHIR Ahmad. We're both GPs working in a busy family practice in Cheshire. We're part of the NHS frontline, and we're under more pressure than we've ever been before.
Now, if you've never worked in general practice, you might not realise this. One of the biggest drains on our time isn't seeing patients. It's letters. Letters from hospitals, letters from specialists, letters from every corner of the system. And we get up to 500 of them every single day.
We're drowning. And it's not just the big stuff. You know, if a patient so much as sneezes in secondary care, you can be sure we'll get a letter about it. But that doesn't annoy me as much as the letters that I read, and I still don't know what they're trying to tell me. Updates, summaries, acknowledgements, many of which they're just irrelevant to primary care, but they still land squarely in our inbox, demanding time and attention.
And behind the scenes, we have 3 full-time staff plus a team of pharmacists just to handle this tidal wave of correspondence. They're reading, interpreting, coding, manually entering the information into our clinical systems every single day.
Let's be clear, this isn't admin. We're using skilled labour so inefficiently, just repeating the process that the hospitals have already done. GPs are acting like data entry clerks instead of clinicians. Frustrating and exhausting. And worst of all, it's unnecessary.
And it's unnecessary because the solution already exists. It's not a new invention, it's not a moonshot. The NHS has already agreed to use global interoperability standards like FHIR APIs, Mesh and SNOMED. And these tools were designed precisely to fix this problem.
So, if they use them, hospitals can send structured, coded discharge summaries and clinic letters that drop directly into our systems. We don't have to do emails, PDFs, scanning, retyping. It's just usable data. It comes in the right format. It comes in securely and instantly.
Imagine this, a patient is discharged from hospital. Their discharge summary, properly structured in the correct format, with standardized headings and coded data, is sent via Mesh to our practice.
And we receive it, our system receives it. Because it's in the right format, it slots it into the correct patient record, highlights the key actions, diagnosis, follow-up actions, updated medications. And then all we have to do is read it, review it, and click to accept. That simple, that powerful.
But that's not what's happening. Instead, we're buried in letters that we have to process manually. Important details, a medication change, an allergy, a new diagnosis, often buried in paragraphs and paragraphs of free text. Easy to miss, really risky to ignore.
And so we end up in the situation where you waste hours chasing information and then transcribing data that already exists in the digital form, and then you have to double check every document to avoid dangerous omissions. So inefficient, but it's also dangerous to patient safety. It's a concern.
So why hasn't this been fixed? The answer, as usual, lies in the complexity of the NHS. Legacy IT systems in hospitals that can't output structured messages, and poor enforcement by the commissioners of digital standards, and a cultural resistance to change. And crucially, a lack of meaningful accountability.
Yeah, so even though NHS England mandated structured electronic discharge summaries back in 2021, many trusts still haven't complied. And well, why do that? Because there's no penalties to doing this. And the result, you've got a digital postcode lottery. You know, some GPs, the lucky ones, they get clean coded data.
Very few of them.
Yeah. And the rest of us, we're still stuck with paper, emails, PDFs that we have to recode to put in our system.
Meanwhile, clinical time is being burned up on admin. Every hour spent manually retyping or reading letters, paragraphs and paragraphs of meaningless information that's been sent to us, every hour spent doing that is an hour not spent with a patient. And across the country, that adds up to millions of lost appointments and thousands of demoralised clinicians.
Not to mention the forests that have been felled for this. So here's our plea and our proposal. Enforce the standards that already exist. This should be part of hospitals. When they send messages, it should be mandatory that they send them structured, coded, using the systems they have, using mesh. Support them, you know, if they need to upgrade their legacy systems, whatever technical blockers are in the way, help remove them. Get them communicating with us in a sensible, efficient and safe way.
Include this in the Prime Minister's Red Tape Challenge. Because if we're serious about freeing up NHS time and reducing bureaucracy and making the system work better for patients, then this is actually low-hanging fruit.
Yeah. So stop primary care, stop your GPs from suffocating under paperwork. You know, let's unleash the full potential of modern interoperable electronic records. Return valuable time and headspace to every GP practice across the country.
This isn't about fancy new gadgets or AI in the cloud. It's about getting the basics right, making sure information flows as it should, securely, accurately and efficiently from one part of the NHS to another.
Because we know when data flows properly, we know care flows properly. And where care flows properly, patients benefit.
Remember, the standards are there, the technology is ready.
Yes.
What we need now is leadership, political will.
And a bit of common sense.
Absolutely.
So we need to stop talking about interoperability as a long-term goal and start treating it as an urgent priority now.
For the sake of GPs, for the sake of patients, and for the sake of a health service that desperately needs to breathe again.
Let's connect the dots and make this happen.